Hi everyone and welcome to TheraWin.Tales, your one-stop shop for exploring the beauty of culture and therapy. Today we're back with episode 2 in conversation with Dr. Manasi, honoring July for its minority mental health. So let's talk more about disability and mental health struggles. So you mentioned that there are two models, medical as well as social model to it. Right. So, how can we compare the medical model and the social model of disability? And how do these actually impact or influence the kind of therapy and care that we should offer to
Mm,
differently able people?
Good question. So there's actually several models. The medical and social here in the US have been historically the most dominant, right? The social model by Mike Oliver was actually kind of a pushback to the medical model. So medical, social, there's so many. Like I said, the minority model, the model model. In India, the charity model is really big, right? Here too, of like, oh, let me do chat. Oh, like this sense of like pity, right? Oh, how sad. Here, here's some free food. Like, just it's horrible, right? Charity model is filled with pity, which also we don't like. So there's a lot of models. In the therapy space, I'll talk about medical social, but I'll talk about the human rights model, which is my personal favorite as an able bodied person, but my personal favorite. So, a medical model therapist would come into the therapy room and say, where's your doctor? Let me collaborate with your doctor and understand your prescriptions, right? And how can we reduce the impact of the impairment? So if we were to take my dad as this hypothetical client, how do we reduce your pain? How do we manage your pain? Right? That's what a medical model therapist would do. Okay. If you notice, that's important though, right? Pain management is important. But like we said, you can't have only that perspective. The social model, instead, the first question the therapist would ask is, do you feel like the spaces you are in are accessible to you? Do you feel like you have access to these spaces infrastructurally, attitudinally, right? Are you being invited in? Right? So, a social model therapist, instead of looking at the impairment and trying to reduce pain, is going to understand that societies are what are disabling your client. Inaccessible spaces are the problem, right? That's a social model. Some people have pushed back against the social model, but my favorite is actually the human rights model as a therapist, right? The human rights model is fairly simple in that sense. All it says is, you know what, we really need to work on equal access, no matter who you are. It's a civil rights conversation. That's all it is. If I'm treating this person this way, I should treat the other person that way. That's all. There's no complication there. It's complicated in its process, right? And it's complicated in its implementation, but in a way of thinking about it, it's so simple, right? If I can treat you a certain way, I treat the other person a certain way. Everybody deserves equal rights. That's all the human rights model comes down to, and is the one that I use the most in my sessions. Yeah.
Yeah, it's such a powerful model to talk about, right?
Yeah.
Yeah,
Yeah. So concepts like disability pride, all of that come from the human rights model.
right, right.
Yeah.
So, Dr. Shankar, again, models, when we talk about, definitely it's a very easy and very implementable model. It should be there, definitely. But
Hmm.
when we talk
Hmm.
about its implementation, how can,
Hmm.
as a society and um, as a world right now that we're running so much on capitalism, is-
Hmm.
how can we start that conversation that human rights model should be applied in our day-to-day life in the things that we see to make it easier for differently able people or any kind of minority for that matter to live
Hmm.
their life peacefully and happily and with all the enjoying all the rights that they have.
Yes. And respect, right? Like respect has been so undermined in this community. So yes. So the reason why people prioritize models so much is because models determine ways of thinking which determine language, right?
Mhm.
So if you notice, I, have, and I'm getting better at this, I'm working on it, but we talk about a disabled person versus a person with disability, right? Which is a very
Mhm.
social model way of thinking, because you're disabled by society. You're not disabled by your
Mhm.
impairment, right? So the model, if you see, is influencing language, right? And the way we talk about something, the way we have a conversation about something impacts the way we think about it. The way we think about something impacts the way we treat people. So if we are thinking karma, this person has done something bad, then that's how we're going to treat them. We're going to treat them as somebody who deserves punishment. But if we're thinking, right, in our heads, the way we're conceptualizing it is this person is a product of centuries of oppression, and we have work to do. And we cannot be a fully inclusive society if we're making active choices to exclude, which is a very human rights model of way of thinking. Then that's going to impact the way that we're treating these people, right? That's going to impact the way we're having conversations with them. That's going to impact policy. And so it has that trickle down effect. And what we want to get to is real change. And so models, language, conversations, treatment.
Definitely. Yeah.
Yeah.
Right. Now, talking about the second model, the second topic that you talk about, after model, it comes about language. So the first,
Yes.
and I think the most important question that everybody should ask about, when we
Hmm.
refer to somebody who is differently able, do we refer
Hmm.
them as disabled people, or is it better to call them as differently abled?
So we don't use differently able here in the US. I think there's cultural nuances, right? And I'm not an expert in the Indian context. Like, I'm still learning about it because I'm here in the US. We don't use differently abled because when you say different, you are making the assumption of a standard, right? So let's say you are in a row of houses in a part of a community that all look the same, and there's one house that's different. It's contributing in a
Yeah.
sense to the othering, right? We're saying that there's one standard of houses and this one is different. So that's a big part of the reason we don't use differently abled, because we don't want to assume that there's one standard of a body, right? People in the US shift between person with disability and disabled person. A lot of social model thinkers, like I said, say disabled person, which is called the identity first. So person first versus identity first is what it's called. So identity first is saying I'm an autistic person. Person first is saying I'm a
Yeah.
person with autism, right? So there's identity first and person first language. My favorite way to navigate this very complex situation is to ask, right? I just ask my clients. I'll just ask my clients, hey, some people prefer identity first language because it honors their identity. You don't say person who is
Right.
gay, right? You say a gay person with pride. And so I ask them,
Yeah.
I'll say, do you like identity first language? And they might say, yes, I'm a proud autistic person, right? Or the person might say, no, I'm a person first. My impairment comes next. So I'm a person with autism. So the best way to do this is, again, because respect is so important, pay attention to language that your client is using. Ask, again, curiosity, just ask. Don't be ignorant, because it's not the job of your client to teach you, but just ask, right? And just say, hey, some of my clients prefer identity first language, while others prefer person first language. I'm curious what you prefer. What makes you feel respected and seen? Right? And they'll give you an answer and you go with that because they are the experts, not you, not us.
Yeah. Right. I'm glad I asked this question because I myself was navigating through what to select when I was having a conversation with you. And that's what it takes, right? Next thing that we talk about that you mentioned was conversation. I think this is how we will get there. to start the
Yes.
conversation about it, to ask questions like these.
Absolutely. I'm working on a book, so stay tuned. But in the book, one of the
Wow.
hardest, yeah, one of the hardest things that I was bumping into, one of the hardest challenges was language, right? Because
Hmm.
if I wanted the text to be consistent and coherent, so I didn't want to use identity first in one place and person first in another place. I didn't want to do that, right? I wanted consistency, but I knew that choosing one option is going to exclude the experiences of somebody else, so that was
Yeah.
such a hard process to navigate. Which language am I using? So again, I expressed curiosity and I turned to disabled people and said, what do you prefer? And I also turned to the APA. So the American Psychological Association talks about preferring social model language, which is saying disabled person. And I also asked a lot of my contributors and disabled people around me, and they said it's always safer in a sense to go with the social model, and say disabled person. So you are celebrating identity, you're not pushing it down, right? You're not going, like I
Yeah.
said, you're not going to say person who is black, right? You say a black person with pride. You don't say a person who's Indian, you say an Indian girl with pride,
Yeah.
right? And so then why should we say a person with disability? You say disabled person, right? Because
True.
society is what is disabling them. So again, there's lots of people that would disagree with this, and that's totally fair. But that's why, like in my book, we're talking a lot through the social model language, of disability and saying disabled person.
Yeah. We are very excited about the book, by the way. Could you, you know, soft launch the name of it,
Oh
if
God.
that's
I don't know if it's soft launch. So it's still in the works. I'm partnering with Taylor and Francis, which is a publishing company based in the UK. And Taylor and Francis does a beautiful job of creating texts for therapists to work with underserved populations, right? And underserved, especially in the mental health space. So they have this great LGBTQIA plus handbook, and then the next in line was disability. So for me, Sakshi, it was one of the most humbling, beautiful, incredible experiences of my life to work on this book. And so this book, it's a handbook, and so we're working on training therapists to work with disabled clients in therapy, because again, because we haven't had a seat at that table, now we're inviting therapists onto that table, right? And saying, you guys, actually, we are so trained. And so I have some incredible contributors. 80 to 83% of my contributors are disabled themselves. They are experts in the field, they're scholars. They are talking about how we can treat people with disability in a way that is fair, respectful, but also very effective. Because I often say this, like, we want therapy not just to be a safe and accessible place, of course we do, but we also want it to be effective. If you come in as a client to me with depression, you don't want just a safe and accessible place, you want your depression gone, right? So how
right?
do we as therapists work with disabled people to make therapy accessible, safe, respectful, but also effective and competent, right? So that's what this handbook is about. I'm very excited for it. We have a lot of disabled artists involved. So we have artists that are introducing every section with either visual art or poetry and prose. And there's not a lot of textbooks like that. So I'm super excited. I'm very grateful to my contributors who are just mind blowing. Like, they are just incredible. So yeah, stay tuned. 2025, hopefully, is when we'll have it.
Wow, yeah, we are excited about it.
Yeah, thank you.
Right. So, Dr. Shankar, taking from your book itself, you mentioned that it's about how can therapists be, um, since they're already trained in this, to get a seat
Mhm,
on that table where they can serve the disabled community. Right. So, what
mhm,
strategies can therapists use to create affirmative and safe space for
mhm,
disabled client?
mhm. Good question. So, the first step towards that is for you as a therapist to check your own prejudice. Go to supervision, go to therapy, seek consultation, do whatever you need to really work on your own biases, your own prejudice. There's so many tests online that you can do for free called implicit tests, implicit bias tests, right? Go and do those tests. Do trainings. Like you check your own as a therapist. That's the first step, right? And then the second step is create an accessible space infrastructurally, right? Have, obviously have a ramp, have an elevator, light is important, offer virtual sessions. There are lots of platforms that offer closed captioning. This is so hard to do, but there are therapists in the US here who have interpreters who know sign language, right? Like those are all ways that you can make your spaces accessible. But more importantly, like we said, more important than infrastructural accessibility is attitudinal accessibility, right? And so there's a scholar. Her name is Dr. Rhoda Olkin. So Rhodaolkin. Dr. Rhoda Olkin talks about this idea of disability affirmative therapy. She was a major like proponent of that concept, right? And I'm so fortunate because she's also contributed a chapter to our book. And Dr. Olkin talks about how do we create affirmative therapy, right? And she has a 7-step process that's super easy to follow. She talks about disability etiquette. Is it okay to touch disabled people? How do we approach that question? Because a lot of disabled people are touched inappropriately by medical professionals a lot, right? Or appropriately, but they're touched a lot, right? And so,
Right.
what is their relationship to touch? Little things like that that we don't think about as therapists, you know?
Yeah.
So, read up on that, do your research. Disability affirmative therapy starts with a psychological process within the therapist, then it moves to education and learning, and then it moves to curiosity and understanding the unique needs of your client that can't be generalized. But yeah,
Right.
language is a
Right.
big part of that as well. Hmm.
Right. Thank you so much for sharing that with us.
Of course.
And I'm sure it's gonna be helpful to a lot of people out there, not just therapists, but also um, people in their day to day life, how they navigate and how they change their language when they talk to people with disability. Right.
Right, right. Yeah, yeah. And also collaboration is important. When in my previous practice, right, I did a lot of what we call ROIs, your release of information, to work with, let's say, medical doctors, right? Social workers. I don't know how the social work process works in India, right? But working here, people work with housing because a lot of disabled people are on the streets and are homeless because they don't have access to safe and affordable housing, right? So a lot of your work as a therapist is also collaboration. Who are you collaborating with? Build a team, right? Tell all my clients, like, we are a team that are working together for you, whether that's with a doctor,
Yeah.
psychiatrist, whoever, like, we're working together to serve you. So collaboration is a big part of disability affirmative therapy also.
Yeah, right. Rightly mentioned. Definitely. As a community, we could do so much that as an individual, we cannot. And I think where we have reached right now when talking about mental health or mental health for minority people, it's all built upon the work that as a community we have done.
Yeah, yeah, yeah. Oh my God,
Right.
yes. It's not a one person. We can't, right? We're social beings at the end of the day. And I think sometimes in today's society with Instagram and TikTok and all of that, we're forgetting that. Like the world is more connected than ever before, but the world is more disconnected than ever before.
Yes. Right.
And so you're absolutely right. If we don't work as a community, and I think what's really important to pay attention there and be careful when we say work as a community, we're not, as able-bodied people, we're not the leaders of that community. It's very easy to fall
Mm,
into that trap and say, let me save you. We're not the
mm.
leaders of that community, right? Disabled people have always been the leaders of that community. We are there to listen, and we are there to, finally push towards just respect. Like we said, it's such a simple concept, but respect.
Definitely. And it's similar to the
Yeah.
one model that you mentioned, I think charity model, right? Where
Yes.
people kind
Hmm.
of show the pity that it's in their hand to change their their life,
Right,
a person
right,
with disabled person's life. So
right.
how prevalent is this charity model throughout the world, and what are actually its implications on disabled individuals?
Mm-hmm. Mm-hmm. I'll answer the first part of that question first, right? I think charity model is prevalent all across the globe. We see somebody who is disabled and we say, "Oh my God, are you okay? Oh no, do you need help?" That very strong pity. And there's a sense of powerlessness that's tied to that sentiment. When you pity someone, so a person that I would pity is, let's say, one of my friends had a horrible breakup, right? And they're crying all the time. I pity them. I hope they're okay, and I feel bad for them, right? But that's not the same
Yeah.
sentiment as a disabled person is moving around with on a day-to-day basis. So the more we pity somebody who is disabled, we are encouraging and we're reinforcing that powerlessness. We pity something that's less than us. Pity something that's bad. We pity something that's negative and we feel bad for. That's what pity essentially means, right, in the dictionary. And so, why are we pitying people who just look different from us as able bodied people, right? So, the pity charity model is very problematic because there's a sense of very deep powerlessness that we're assuming.
Right, right,
And that impacts your psyche, right? Imagine if for all of us, someone just looked at you with pity all the time. Then you're like, oh, something must be wrong with me then.
right. Yeah, yeah,
That's
right.
not a nice feeling.
And it definitely not a nice feeling, and it just makes us think so much that these communities are going through, right? In their
Mhm.
family, within their relatives, people. It's not a nice feeling at all.
Oh my God,
We as a
that's
society
no.
are talking. Right. We as a society are talking so much about that, how people are talking about us, about our color, about our weight, but nobody's talking about
Yeah,
this, that you do not walk to a disabled person and show pity. They do not need it, right? They're
yeah, they do
happy
not.
in however that
Yes,
they are.
right. And you
Right.
brought up such a good point, Sakshi, when you said relatives, right? It just reminded me of our Indian diaspora where everything is about relatives and neighbors and we know that, right? It's such a collectivistic culture and we have the good points of collectivism, right? The advantages, but we also have the disadvantages, which
Yeah.
unfortunately, so many arranged marriage people who are unhappily arranged marriage, not happily, unhappily arranged marriage. No, right? So much of it is what are they going to say? What are neighbors going to say? What are relatives going to say? And the shame that's tied to disabled people and disabled family members, right? And, a really, really sad statistic in our country, in India, is we actually see a lot of disabled children dropped off at orphanages.
Yeah.
They're abandoned at a very, very early age. They're abandoned because they're disabled, right? Why? Because of what we're saying, the shame that people assume. What will relatives say? Maybe it's karma, and all of these very problematic ways of thinking that have led to abandoning children who are disabled in our country, that then lead to things like poverty and houselessness,
Yeah.
right? And home insecurity and all of these complex problems.
Yeah, right. In India, and I'm sure throughout the world as well, what will people say? I think that's a question that
Yes.
is causing a lot of a lot of troubles
Yeah.
out there. A lot of troubles.
Yeah.
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 So
What will people say is a huge one in our country.
right, definitely. So according to you, Dr. Shankar, what steps can society take to
Mhm,
destigmatize disability and promote that, attitudinal shift from
mhm,
thinking about what only thinking about what people say to it's okay. We have to care about our loved ones and make sure that we provide everything to them so that they can live happy, fulfilled life? How can we destigmatize and change
Yeah.
that attitudinal shift?
Hmm. My favorite thing in the world, Sakshi, in the world, in every context, my favorite thing in the world is conversation, right? Just talk,
Yeah.
talk to each other. People think that conversation is surface level. People think conversation doesn't really lead to anything, but that's absolutely false. If you look at the history of any minority community, any change started with conversation. Just talk, right? Talk to each other with respect, talk to each other, ask questions, have conversations like you and I are having right now, right? Just talk,
Yeah.
because if we're moving towards destigmatization, that can only happen with a collaborative conversation, right? We need to start teaching disability rights in schools, right? To start destigmatization at a very, very early phase and say, this person looks different from you. And that does not mean that they're less than you. That means that they have one impairment that leads them to use a wheelchair, right?
Yeah.
So we need to start the destigmatization process at a very early age when children are so impressionable, right? Spread awareness, do disability pride, talk more, have more seats at the table for disabled people in legislature, right? In legal spaces, have more disabled people, not allies like myself, disabled people at the seat, right? Another piece that I was also thinking about, right, was so there's this concept. I don't know if you've heard about Yuri Bronfenbrenner. So Bronfenbrenner is the psychologist, and he talks about the theory of systems, right? And he says when all of us, we're in the middle of the system, right? We are all here. A disabled person is here, and historically we've only focused on intervention here. We're like, something is wrong with you. You need to change. But we need to start thinking
Yeah.
about Bronfenbrenner's theory, where he says we all exist as a part of different layers of systems, right? So there's the disabled person, there's family, there's school, there's employer, there's society, there's country, there's time. If we understand that the disabled
Yeah.
person's experience is impacted by all of these systems, it's not just this one person's problem, it's all of our problem to solve, right? That's a first step. So it's an attitudinal shift, right? It's saying we need to change this. We need to change how we're thinking. In India, the biggest obstacle is the less than. We need to stop thinking about disabled people as less than. That is the
Yeah.
biggest problem, in my opinion, in India, right? We need to stop that. And then, like we said, the Bronfenbrenner piece, like understanding that disabled people are a part of a system. And then what we said about being comfortable with discomfort. It's okay to be uncomfortable. We'll live, we'll
Yeah.
survive.
True, true that, true. And it's such a strong concept to talk about, right?
Yeah.
That disability is, if we think about it, it's actually a systematic issue. It's a systemic issue that is there. It's not an individual's fault.
It's
That
not.
it's not. It's us who make them feel disabled or
Yes.
something less than us.
Yeah, absolutely. And that is the biggest problem globally with disability. We overemphasize the role of the impairment and we underemphasize the role of society. Of course, impairment can be
Right.
difficult, but so is my job, sometimes, or so is a fractured leg, or so is depression,
Yeah.
or so is a horrible breakup, right? There's so many things that happen in all of our lives. So, why is the fact that a person has to use a wheelchair somehow worse?
Mhm. Right, right. Um, Dr. Shankar, I really want to, talk about this one problem that I personally, when I was in school, right, there was
Mhm,
one student who joined our school on a wheelchair, right, and
mhm.
then we were in sixth or seventh standard, I guess, and then we started talking about, how is she going to manage school, because back at that time uh, we had an elevator but not a ramp, in a lot of places,
Mm.
and then few months down the line we saw that that student, she herself dropped out of school, right? So
Mhm.
do you, and it happens a lot in a lot of infrastructural um, nuances that we see. So do
Yeah.
you think it's okay as a society for us to ask a disabled person to join another school, right, where it's better for her, it's easier for her, or should we as a community bring that changes to them, and how does
Mhm.
it affect the whole narrative that we talk about?
Mhm. That's a really good question, right? And when you were saying the story, immediately I felt like sorrow and a sense of injustice because that child was kind of robbed of education, right? Because of the inaccessibility in the environment. Ideally, in a magic wand world, ideally, we would want schools to be accessible, right? And we would want schools to have the resources to build structures that are accessible to all kinds of different impairments. So
Yeah,
if I was to go back to your school, right, ideally, that's what I would have liked. I would have liked that there were ramps and elevators, and not just for mobility, right? Other forms of accommodations also. Let's say your school did not have the resources for it, which is very realistic, right? Then we actually look at referral. But the process of referral is important. You don't just wash your hands and say, sorry, we don't have this here. You say, okay, why don't you come into my office? Let's work on this together. Here are some options that I found that provide more accessible spaces for you. So instead of washing your hands off that student and that student's needs, you say, let me walk with you to this space and see if that's a better system for you to be a part of.
yeah,
So ideally, yes, we should be building more accessible spaces. If we don't have the resources for it, while we're building it, we can, we don't have to expect the disabled person to wait for us. We can refer them to systems
yeah.
that are more accessible.
Right, right. Yeah, we should focus on the process that you mentioned, not just,
Yes.
washing our hands
Yes.
of it, the process of making sure that we acknowledge that we have something that we can't provide. So to
Right.
help them make that transition
Right.
is really important. Yeah.
And this also
So
speaks to the medical versus social model, right? If that's a very social model way of thinking of saying we are at fault, we didn't provide enough infrastructure for all of our students. We didn't, and so let me help you find somebody who can help you better,
yeah,
right?
yeah,
Yeah.
definitely. So we are having great conversation so far, and right, and I didn't notice the time that
I
we
know, me
have.
too.
I just did that. Okay, so Dr. Shankar, my last question would be: first of all, I would love to carry this conversation because there's so much that I'm learning, and there's so much that I'm sure our audience will be learning from this conversation. But um, we can definitely hop on to other calls for that to expand
Yeah.
on these topics more. Right. So my last question for the podcast would be that what is your vision for the future of mental health for disabled communities in India as well as globally?
Ah, such a good and difficult question, right? And one I've thought about so much. For me, and I don't know, maybe a lot of people will disagree with me, and I'm open to hearing that disagreement and argument. For me, actually, a successful mental health therapy session looks very similar for people all across, right, the spectrum of abilities. For me, as an able bodied person,
Yeah.
when I go to therapy, I want, let's say I'm going for depression, I want my depression cured
Mm.
in an environment that's safe and respectful and curious and non judgmental and kind and skilled. That's all I want as an able bodied person. I want
Yeah.
us to get to a space where that's exactly what a disabled client can expect as well. So there's no crazy difference in standards. It's the same thing. We just have to bring
Yeah.
all of us to an equal playing ground. I want disabled people to go in, and if they're struggling with depression, to have the exact outcomes and the exact experience as me as an able-bodied person can have.
Definitely. Right. That's a beautiful answer.
I'm glad.
So thank you so much for joining us today. And Dr. Shankar, can you tell our audience where can they connect with you? Online,
Absolutely.
offline? Right.
Absolutely. So you can reach out to my website. That's www.therapyatbay. So that's therapy as in THERAPY, ATBAY, like the Bay Area. So therapyatbay.com. You can also reach out to me on my email. That's Shankar. That's my last name, Shankar at therapyatbay.com. So it's not the symbol, it's the letters. So it's AT. So my email, my website are great ways to reach me. I love, as you could tell, having this conversation. It's so close to my heart. So, I'm happy to connect with people, and I'm happy to connect with you more to continue this conversation.
Yeah. Definitely, same here. Thank you so much for today's call, and I learned so much from you from this conversation, and I'm sure I will be carrying this forward and talking about this more to people, telling people as simple as that how you refer to uh, disabled people and different concepts that you told me. It's beautiful. Thank you so much for that.
You're welcome. Thank you for having me, Sakshi, and for listening.